Please welcome to the podium.
According to Dallas County Health and Human Services, did you know that in 2012, 55% of new HIV diagnoses were persons less than 35 years of age? HIV means human immunodeficiency virus. It weakens your immune system to destroy important cells that fight disease and infection. AIDS means acquired immunodeficiency syndrome. AIDS is the final stage of HIV. At this point, your immune system is badly damaged and deficient. You can take steps to prevent HIV/AIDS. If you are aware of how many people in your community are infected with HIV/AIDS and what activities make you at risk. Today, I'm going to be talking about how many people have HIV in Dallas County, how to prevent contracting the disease, and what are your options for treatment. So let's see who in our community has HIV/AIDS. According to Dallas County Health and Human Services, in 2012, it was estimated about 15,000 people were living with HIV/AIDS in Dallas County, representing an increase of 62% over the past 10 years. According to Dallas County Health and Human Services, in 2012, new HIV/AIDS diagnoses, 639 were male, 141 were female. According to Dallas County Health and Human Services in 2012, there are 11,986 men and 2,816 women living with HIV/AIDS. 43% are African American, 34% are Caucasian, 22% are Hispanic, and 1% are other. Now we know the percentage of people who have the disease. Let's discuss how to prevent it. According to the Centers of Disease Control and Prevention, HIV can be prevented through abstinence, mutual monogamy, and condoms. Those of us who don't know what mutual monogamy is, it's having a relationship with one partner and both of you are faithful in the relationship. According to the Centers of Disease Control and Prevention, HIV can also be prevented by not sharing needles during drug use and drug paraphernalia, and by eliminating the use of substances that impair judgment. Some substances will impair judgment to where you will not do things that you would normally do if you weren't impaired. So it's good to not be impaired. I've told you about about prevention. Let's discuss treatment. According to HIV/AIDS treatment and drugs at the MayoClinic.com, there is no cure for HIV/AIDS, but a variety of drugs can be used in combination to control the virus. Start treatment if you have severe symptoms. If you're pregnant, if you have HIV-related kidney disease, or you're being treated for hepatitis B. According to HIV/AIDS treatments and drugs, Mayo Clinic treatment can be difficult. Taking multiple pills at specific times every day for the rest of your life. According to HIV/AIDS treatments and drugs, MayoClinic.com, side effects can include nausea, vomiting, diarrhea, abnormal heartbeats, shortness of breath, skin rash, weakened bones, particularly in the hip joint. As you can see, treatment is minimal and can be painful. I am credible for HIV/AIDS because I know people in my community that have this virus. And I have seen over the years the toll that it has taken on them in their bodies. Sometimes you can't visually tell the people that have HIV, but some signs are darkness in their eyes, in their eye joints, in their fingernails. Some of them begin to get thin. So, but you can't tell. It's a silent virus that you don't know who has it. In conclusion, I have informed you how many people have HIV/AIDS, how to prevent, and treatment. HIV is a very real disease in our community, and you or someone you know can be affected.